All right, let's dive right in. We're talking about a conflict, a clash, really, that's shaking the very foundations of modern healthcare. And trust me, it goes way deeper than you might think. This isn't some friendly debate over which method is better. No, what we're actually witnessing is a high-stakes collision. It's about power, it's about influence, and it's about who gets to call the shots. Okay, so to get our heads around this, let's start with the battleground we all think we know. This is the version of the story we usually hear. So, in this corner, you've got Western or modern medicine, and in the other corner, Eastern or traditional medicine, right? These are the two giants, the two main schools of thought that we're always told are completely at odds with each other. And this is where you really see the core difference in their whole philosophy. One side, it's all about attacking the disease head-on, zeroing in on symptoms, on pathogens. The other side, it's all about harmonizing the entire person, the body, the mind, the spirit, seeing it all as one big connected system. The goal there is to restore balance. I mean, they sound like polar opposites, right? But is that really the whole story? And asking that question, well, it leads us down a different path, towards a kind of hidden influence. You gotta wonder, is this whole East versus West clash just a natural part of how medicine evolves? Or is there something else going on behind the scenes? Which brings us to an even sharper question. It's a classic, really. Whenever you see two sides pitted against each other like this, you have to ask, who actually benefits from the conflict itself? Because what the source material suggests is this rivalry, it isn't natural at all. The argument is that it's being actively fueled, maybe even steered by a controlling hand that we don't usually see. So who are these rule makers? Well, the argument points to huge institutions like the World Health Organization, the FDA, and of course, Big Pharma. And the idea is they do more than just regulate. They actually build the system, a system where the main goal, ultimately, is maximizing profit. Think about it. They set the standards for what's an approved treatment. They define what evidence-based medicine even means. And in doing that, they can create a market that really, really favors the stuff you can patent, the high-profit drugs, over anything else. And this all leads to a really critical idea, the marketization of medicine. It's a fancy word, but it's simple. It's what happens when you start applying the rules of business and commerce to something as personal as human health. And you can see how that completely transforms everything. Step 1, an illness stops being just a condition and becomes a product, a problem that needs a solution you can buy. Step 2, the doctor's role shifts from healer to a seller, basically, a provider of that product. And that means step 3, the patient becomes a customer. Okay, so you've got all these massive forces clashing, but where does that leave the most important person in this entire equation? Let's talk about the patient, because they're the one caught right in the crossfire. Just put yourself in their shoes for a second. You're the one who's sick, and suddenly you're hit with these massive, overwhelming questions. The first one is so simple, but it's huge. Who do you even trust? And then the next one hits you. Who do you follow? You've got all this conflicting advice, these totally different systems. Which path do you take? And it all comes crashing down to this one brutal question, a question that really gets to the heart of the problem. Are you trying to live, or are you just being asked to buy? So, maybe we've been looking at this all wrong. What if the real choice isn't East versus West? What if it's not about methods at all, but about principle? And here it is. This is the question that everything else hinges on. Who does medicine serve? Does it serve humans, or does it serve shareholders? So what would true medicine even look like then? Well, this perspective lays out 3 key principles. First, it has to be grounded in real science, and that means all of the science, not just the bits that help sell a product. Second, it's guided by conscience, right? A real, unwavering commitment to what's best for the patient. And finally, and this is the big one, it has to be independent from all those commercial interests that can twist its purpose. And that's really the final takeaway here. The real clash, it isn't East versus West. It's not traditional versus modern. The real battle line, the one that truly matters, is humanity versus the market. And the question that leaves us with is, which one are we choosing to build?